this is the health assessment part 2. We started on the 1, you can break it up so it uploads easier. So this is part 2, we're gonna start with respiratory and lung sounds. So first we're going to, like I mentioned before, she's not using any of her accessory muscles to breathe. I can tell that she's just breathing through her chest like she should be. And so we're gonna go ahead and listen to her lung sounds. So we're going to do 6 on the front and 6 on the back. As I move the stethoscope, I would like you to breathe in and breathe out with every move. If you could do that for me, please. Okay. This is the right upper lobe. It's the left upper lobe. It's the right middle lobe. This is the left upper lobe. Well, left bottom lower lobe. Right lower lobe, left lower lobe. Okay, you could turn around. Okay. We're going to start with the left upper lobe, right upper lobe, left lower lobe, right lower lobe, left again, right lower lobe again. Okay, I don't hear any adventitious sounds. Everything sounds good. There's no crackles, no wheezes, no pop-ins, no sounds it shouldn't be making. Okay, so now we're going to move on to cardiovascular. First, I'm going to palpate her carotid artery. You do them separately, don't do them together like you do the radial. Okay, feels normal. Next, I'm going to assess for jugular vein distension, JVD. I don't see any present here, but if I would put her back at a 45-degree angle, and then I would get out the tools to measure it. Next, we're going to do her radial pulses. So I'm going to turn the inside here. Okay, they feel good. For rate, rhythm, and amplitude, it all feels normal. I would rate them as a 2+, which is within normal range. Put those back down. Now we're going to do her pedal pulses. We're going to do her dorsal pedialis and her posterior tibialis. You bring your foot up. Okay. And there's her dorsal pedialis on her left foot. And there's her posterior tibialis on her left. Now we're going to go on her right foot. There's her dorsal pedialis. And you can't see this, but here's her right posterior tibialis. Okay. So those were all also regular. I could feel them. They were normal. They weren't bounding and they weren't weak. I'd rate them as a 2+ as well. Next, we're going to do GI. So if you could, we don't have a bed here, so she's just going to stand up and we're going to do this. Lift up your shirt, Mom. Okay. We're going to start by inspecting. The color is, and the color of her skin is correct for her ethnicity. It is even skin tone. I don't see any bruising. I don't see any like vein colorations coming out. I don't see any hernias around her belly button or anything, her umbilicus. It all looks symmetrical and even as it should. So next we're going to auscultate. You want to auscultate first before you palpate, because if you start palpating, you can increase bowel sounds by poking around, and you want to make sure that you're getting accurate bowel sounds, so we're going to auscultate first. And we're going to start with the left lower quadrant, and we're going to work our way around. This is her right lower. This is her right upper. This is her left upper. And her left lower. Everything sounds good. Her vowel sounds are normal active, so it sounds as it should be. Next, we're going to palpate those same quadrants. We're going to do just light palpation with 3 fingers. You shouldn't really be able to feel any of the organs in the abdomen. Maybe the liver slightly in the right angle, but you really shouldn't. Okay, I don't feel anything like I should. So we're done with that. So we're going to move on to muscular and range of motion. So first we'll do your upper extremities first, so you can sit down. Take this off. Okay, we're going to do your shoulder. Okay, so first I'm going to make sure that you can touch these, that the contour of her muscles feel even, that all the muscles and bones feel the same, which they are. You can also look at them this way to make sure it's the same, this direction, which it is. So I would say that they are bilaterally symmetrical and they have even and bilateral contour as well. So now we're going to do range of motion. Can you abduct away? Can you adduct back? Can you put them above your head? Can you kind of put them behind you a little bit? Okay, then can you circumduct in the circle? Okay, it's a ball joint, so it should be able to circumduct like that. Okay, now we're going to test, so she's got full range of motion on both sides. Now we're going to test strength. Can you push your arm out? Okay, and can you push your arm back in? Okay, you push your arm out, you push it back down. Okay, so she can do that with full resistance, full strength with full resistance, so that would be a 5. Now we're going to do your wrist. Okay, can you push them back? Can you put them forward? You do a little wave motion. You can turn them around. Okay, she's got full range of motion in her wrist as well. So now we're going to test strength. Okay, can you push your hands back? Push your hands back. That's it. Okay, now push forward. Okay, she's got full strength in her wrists, and the contour of them and the shape of them is also equal bilaterally, and the strength is equal bilaterally, and so is range of motion. So she can do all that. There's no swelling. I can see everything, and it all is even with each other. Okay, so now you can stand up, and we'll do your hip, and then we'll do your ankle. You can sit down for the ankle. Okay, so first you would make sure that they are equal bilaterally, and you don't feel anything odd or anything. So I'm going to say that they are equal bilaterally, the contour is the same, and they're symmetrical. Okay, so can you abduct your leg away? Okay, can you adduct back in, obviously? Can you do the other one, back in? Can you internal rotate? Can you external rotate? You do it the other leg, internal rotate, external rotate, and then can you circumduct? Okay. It's also a ball joint, so it should be able to circumduct like that in a circle. Okay, so she's got full range of motion in her hips. We're going to test strength, so you can actually sit down for this one. Okay, I'm going to push down against your thigh. I want you to push your leg up. Okay, I'm going to grab this. Can you push your thigh back down? Okay, same thing with this. Good job. So she's got full strength of resistance there too, so that would also be a 5. Okay, so now we're going to do her ankle. Okay, can you dorsiflex back? Can you plantar flex forward? Can you invert, eversion, and roll it around? Okay, we'll test the strength over here. Can you push against my hand? Okay, can you pull up against my hand? Okay, she's got full range of motion in her left ankle, and it's, here, I'll hold them up both real fast. They're both equal, but bilaterally in shape and contour, and they look good. I don't see any signs of swelling or edema in her ankles. She has full range of motion and strength in her left. Now we're going to test her right. Okay, can you go back, forward, inversion, eversion, and all around? Okay, you push against my hand. You pull up against my hand. Okay, her right ankle also has full range of motion and full strength at a 5. Okay, and now we're going to test the dull and soft test. She's gonna close her eyes. I'm going to touch her all over and on all of her extremities, and then when she feels the soft point of this Q-tip, she's going to say soft, and when she feels the pokey part, the harder part of it, the plastic, she's gonna say dull. Probably a little more sharp than it is dull, but that's the words we're gonna use. And this is going to be testing that she can feel things everywhere, because you could also, if you thought somebody had peripheral neuropathy, you could put a tuning fork on their foot, on their big toe, and hit the tuning fork with your hand, put it on their big toe, and that's usually one of the signs, if they can't feel that they're going to start having peripheral neuropathy. Okay, so close your eyes.
Soft. Dull. Soft. Dull. Dull.
No, soft.
Because
Close your eyes.
it's the same. Poke me harder.
Okay, I will. Close your eyes.
That's dull.
Okay.
Soft. Dull. Soft. Dull. Soft. Dull. Dull. Soft. 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 Dull.
Okay, so she is feeling, and apparently I didn't poke her hard enough, but she feels it on both of her upper extremities and her lower extremities, and even I did her feet too. So she feels those. Her gait when she walked in was normal. She didn't use any assistive devices, and when she was standing up, she seemed to have good balance, and she was able to complete those. So I would say her gait's good, and she's got no neuro issues with affecting her balance. So at the end of the assessment, you would thank your patient for coming here and their patience, and for being cooperative while you were doing your assessment. Did you have any pain that came up when you were doing any of those things? All right, that's good. Nothing came up, because she said earlier in the first video that she didn't have any pain at the very beginning. So making sure nothing came up. If we were in a hospital setting, I would ask her, do you need anything to drink? Do you need any comforts? But we're here at home, so I don't need any of those. And then I would, if she was in a hospital setting again, I would put up the rails, lower the bed, put the lock on the bed, lock the wheels in, and I would give her the call light. And I would then thank my patient again for her cooperation, because this is a very long assessment to do for the full one. And then I would wash my hands, perform hand hygiene, and I would then exit. And that's the end.